Module 4, Part 1, Principles of Clinical Telehealth. Brought to you by IMU and Onsana Health. This session is delivered by Dr. Verna Lee Carmun from International Medical University, IMU. By the end of this session, you will be able to explain measures that support and facilitate the safe use of telehealth consultations, describe how information from the patient's surroundings can be incorporated into clinical assessment, and demonstrate how telehealth can complement or enhance in-person practices.
I will be covering some of the what you need to do before, and then during, and of course after the telehealth consultation. So this would be my outline of my talk. Okay, so I would like to highlight there are 5 important checklists, I would say, in preparing for the telehealth session in our practice. The first thing is to need to select appropriate patients. Okay, we need to select whether our patients are more suitable for telehealth or they are more suitable for in-person examination. Okay, we also need to train them, see whether they are ready for telehealth. Next, of course, I think as Aisha mentioned, that obtaining informed consent is very important, yeah, and then only you probably schedule the appointment. The third checklist would be triaging. So as we know, not all patients are suitable, so you need to really look at your own patients, yeah. Fourth is whether you have the physical environment that is suitable for telehealth, like what Dr. Ellen said, you have to lock the door. And then, of course, just like in person, we need to know the patient. So we have to check the patient past record before you start the telehealth. So this is pre-telehealth. And I would like to focus very much on the first point. So the next few slides, I would like to emphasize some of the principles that we use to choose our patient. Okay, because not all patients are suitable. The first principle is clinical outcome. So we need to ask ourselves, what do we want to achieve, right? If it's just a management of acute problem, such as AGE or URTI, which is self-limiting, so that should be okay. But what about if it's like more serious acute problem, acute diseases like dengue fever and migraine? Okay, our practice ready for that? Are we ready? Do we have a plan if the patient deteriorates? All right, so we need to have some sort of planning before we decide that, yes, we're going to take in all the acute cases for our telehealth. Well, on this matter, we have prepared some case studies. Yeah, so please make sure that you complete all the case studies where I actually have tried to put in some important issues that we need to plan during the escalation and safe management. So I hope this is just a concept lecture. So I hope after this, the next few days, you have a chance to complete the case studies. Also from Big 3, from Big 3, we know that patients with stable conditions like hypertension, diabetes, who need regular follow-up and monitoring are very suitable for telehealth. So this could be one of the plus points of doing telehealth. Right. The second principle is very much related to our confidence, right? We need to ask ourselves this: are we confident that this patient does not need any in-person examination? Okay, the patient that you have selected for telehealth. If the answer is yes, then the patient is more or less very suitable for telehealth, right? For example, if a patient have diarrhea, or with dehydration, and you think he or she needs some parenteral fluid, so maybe telehealth is not so suitable. All right. The other thing is, the third principle is when we need to inform or explain very important or very serious conditions like this, for examples here. Maybe in-person kind of consultation is a better option, right? Especially if this is the first time you are going to tell the patients of their diagnosis. So if the patient has been diagnosed but only needs some counseling and follow-up, then telehealth may be suitable. But if this is the first time you are going to reveal to them that they need certain medical treatment, that they needs to have certain diagnosis, maybe that's not a good idea to have it on telehealth. Right. This because very obviously communication with in-person in these circumstances allow us to if they have some reaction to it, we can manage them properly. So we can address their concerns, their expectations as promptly by doing in person, because sometimes by just looking straight into the patient's eyes, I think doctors, you know what I mean. So you may actually communicate better. Okay. The other thing is when you explain some long-term management, for example, lifestyle changes, medication compliance, sometimes you need to use some drawing or some pen and pencil, or you want to explain it with more how do we call it, with more importance. So you may want to do it in person rather than telehealth. The other one is breaking bad news. So sometimes doing the in-person communication would be better to convey bad news, right? Because you may be able to just hang over a tissue paper when the patient needs it. So you can't do that in telehealth. All right. So as okay, this slide is just to remind all of us, right? It's a good practice to document of an informed consent for telehealth, whether it's for a new diagnosis or a test. So in our medical record, yeah. And I like to highlight, I like to take this opportunity to remind all participants to complete another self-learning package in the LMS for week 4 about clinical documentation. The last principle in selecting patients is patient readiness. Some of the obvious factors are listed here. So we know that I think doctors know our patients well. So we know our own patients better, and we need to assess if they are able to and willing to do telehealth. Okay, and whether their house or their workplace has appropriate hardware and software, and whether their circumstances allow them to travel, and and their physical or mental capacity also very important. Whether they are suitable to do telehealth. So I think by the time you know your patient well, you will know whether they are ready or not. So it's not one magical bullet that that you can say, I want to do telehealth tomorrow. No, you just really have to plan and select your patient properly. All right, once we are ready and we are prepared, and I think these are some of the points that we need to inform our patient about our telehealth services. So we try to always use very simple language, always give them options that, besides telehealth, you can have other options. And then if you are charging them extra, inform them beforehand, and then duration of the telehealth, you offer 15 minutes, 10 minutes, so that is an expectation from you and from patient. And of course, give them options if they prefer what language during the telehealth, or even the doctor. Inform them some limitations of telehealth, and it is good if you can inform them in writing, like for example through e-notifications. These are some of the examples that I've got, I found that telehealth has its own limitations. So you probably have to inform them and let them know, for example, like this, not suitable for emergency conditions or severe symptoms, and children below 16, there should be someone with them. Yeah, they should not be in the telehealth alone. And these are the other useful notifications that you can inform your patients. You can read these slides. So it's not it depends on your clinic and your practice, no. So you may want to create your own e-notification for your patients who are using telehealth. Okay. Right. On the second part I want to talk about is on the day of telehealth. Right. What do we need to do? Right. Still, even if you have booked the appointment, the patient said, I'm coming in, we are logging in. It is still very important to still find out, is this patient suitable or not? Is there anything that may have happened? So there are some way to look at it that using triage tools, right? You can create your own one. You can create a form and then ask the patient to put down the symptom. Okay, and then even though if it's booked, and if you still think, if you think at the last 5 minutes that the patient is not suitable, you can tell the patient, no, well, if he or she need an in-person consultation, it can be converted, right? And you can ask the patient to come to the clinic or send them to the nearest clinic. Okay, just before you log in and turn your video on, is a good practice quickly to look at the patient's past health record. When was the last time he or she come to see you? And also take note of the phone number, as like, I think all of us experience this, video connection may fail us. We never know when is that. So it's a good practice. Yeah. Okay, the other one is the environment. During the consultation, we should make sure that our room is, nobody's walking in and out. So the privacy is utmost important. Yeah. Just like in-person consultation, it's confidentiality, the privacy, you still have to maintain that. Just put a no entry sign or lock the door. Remember to make sure your microphone, your speakers, your internet connections are functioning well. Okay, these are just a simple reminder. And at the start of the consultation, always make sure that's the patient that you are talking to. Check the name, maybe check the phone number, some identification. Okay, if you have not seen the patient, of course you have seen the patient and it's your follow-up, you will know the patients well. Okay, and the other one is check the patient location. They may be alone in the room, or they may be in a shopping mall somewhere. So you have to find out where the patient is, just in case there's any emergency. Okay, advise the patient, if let's say you couldn't identify and the patient probably not the right patient, or you're not sure, so you may not want to continue the consultation. Okay. All right. The clinical part. So some measures we can use as a healthcare provider to ensure safe use. Yeah. So just like in-person consultation, I think we cannot skip the history. Yeah, a good detailed history will help us to make the correct diagnosis and provide the correct management. Okay, right. So if there are needed some examination can be done at home, such as like temperature. So ask the patient if they have a thermometer, they can measure their temperature. If they have a glucometer, if they have a BP set, those are some vital signs are now easily available at home. Okay, of course, a video conference will allow you to observe patient's general appearance. So if you think the general appearance is so important, you have to ask the patient to switch on the video, right? And also look at how the patient breathing like. Today, I'm just going to tell you, but next week, you're going to watch some video on how doctors or nurses can examine eyes, nose, throat, skin, mucous membrane, ears. So don't be surprised, this can be done, and it's quite helpful. Yeah, and it's sort of like that will be the kind of a limited physical examination that we can do. But not just observe, we can also teach the patient or instruct the patient how to self-examine themselves. Not all system, of course. Yeah, I think you know why. So, but certain system like the abdomen, the head, and the neck, yes, yeah, we can actually give clear instruction and tell them what to do. So please watch the video, and then you will see how are these being done. Okay. The last part of it, I'm going to talk about ending and what do we do after the consultation. So once you have talked to the patient, you manage you have done the clinical part. So now you have to tell the patient that, all right, this is the end of the consultation. You need to verbally and physically, visually tell them, so that because some patients, they may want to ask you further questions, they may still want to call you. So, but just to be sure for the patient's safety themselves, they may want to delay their treatment, or they may not understand, they may want to ask you something, they keep contacting you. So, but please tell them this is the end of the consultation, and whatever information or whatever further treatment you want, you need to seek another consultation or call in for another appointment. Okay, so that they know this is the end of it. Right. You may need help here to get your administration or someone to talk up to make sure that the medication are delivered properly. So you may need to tell them, when are you going to get your medicine? How are you going to pay? And what if something happened? Who should they call? MC, well, it's still evolving, I think. But what I feel is we can give MC, but yeah, I think in Malaysia we still need that doctor stamp, that official stamp. Like in my practice, we print out the MC, and then we actually stamp it, and then we scan it in. So with my signature and my stamp. So, and we scan it in, and I can email to my patient, but provided it's been documented with the serial number, with my signature, and with my stamp, which is what I use I use a different ink, so that obviously this is only stamped by me, because I'm holding the stamp with my MMC number. So I think because of the to avoid any medical legal issue in future, right? It's a good practice. Okay, this is my last slide. So lastly, remember, after the consultation, I won't encourage you talking and typing at the same time, but you may want to write some notes or type some important notes, but please make sure your documentation in your medical record is complete. Yeah, right after you end the consultation. Do not wait until the next day. And also make sure that if there's a follow-up, remember to give the follow-up date. All right, and again, the clinical documentation part, I'm not going to talk a lot. This is just 20 minutes talk. So there will be a assignment in the LMS, in the learning portal. Please remember to complete all your pending assignments if you have not already done.